CMS, policymakers, we need them. We don't need them to just do what we want them to do because we think they should. It doesn't work that way. And honestly, that's to me one of the biggest barriers we have in this profession is like a stomping our feet. It should be this way. Why don't they see? Because they don't owe us anything. Their job is to serve their communities and to serve the public. And if you don't reach out directly and work with them, you're not going to get what you want, no matter how many times you say it should be this way, it shouldn't be this way.
Kick it.
Welcome to Strata Stories. My name is Thomas Schreiber. I'm the Director of Marketing here at Strata PT. Strata PT is a single EMR platform and a revenue cycle management service for physical, occupational, and speech therapy practices that helps you achieve a 99.99% reimbursement rate. On today's episode, Paul Singh, the CEO of Strata PT, talks with Dana Strauss, the Senior Director of Government Affairs at CVS Health. Paul and Dana talk through how to position your clinic to capitalize on the policy changes taking place over the next few years, advocating for the PT profession and staying informed, missed opportunities for physical therapists in policy advocacy, quantifying the value of physical therapists in healthcare spending, and lastly, how to get involved in policy advocacy. If you'd like to learn more about Strata PT and see how our EMR and RCM works, head over to stratapt.com to book a demo. Now, without further delay, here's today's episode.
One of the notes that Thomas had there, you said something, the way he wrote it down, and let me use this as a prompt, and let's see where we go with this.
Yeah.
You said, there's a lot of ways for PT clinic owners to position themselves in the right way, given the changes in policy and regulation.
Mm-hmm.
I love this. What can you just elaborate on that? Let's start there and see where we go.
So a lot of ways begins with generally, I don't think the vast majority of PTs or outpatient, especially in the outpatient setting, but I think it encompasses pretty much everyone, are really even aware at the root that everything that we do, that we're allowed to do, that we're paid to do, that how other providers interact with us, the entirety, the whole genesis of that is based on policy. And the greatest way to influence our careers, change in the trajectory of this profession and the related professions is to have not just a voice at the policy table, because I think we have a voice, APT has a voice. I question if it's the right voice or that the focus of the voice is where it should be. So if I can kind of go a little deeper on that, what I experience in the policy space. So, I mean, I interact with health staff, I interact with CMS directly, and then stakeholders across the continuum, but in all of medical care, right? We're not just talking, in fact, I do almost nothing on the rehab front, truly.
Right.
It's primarily Medicare related, but anywhere in health policy. And what I see is what I expected when I was in clinical care and then when I moved into pop health, which is there is a total lack of awareness from PTs that there's this entire world that's happening around them that's deciding our future. And we are hyper focused on things like these little conversion factor fixes, right? These annual fixes. How is the conversion factor going to be cut? When the big problem is that macro law is going to be reformed in the next Congress, and where's our voice as a profession, as a group of professions, where's our voice around what macro reform should look like? How are we contributing to that conversation as a profession? And we're not, right? We're not. What macro reform, if for the listeners who aren't familiar with macro, it's the 2015 law that it replaced the sustainable growth rate, and it connected physician and everyone paid in a physician fee schedule, connected their pay quality. And it's beginning to work, but it's far from achieving the goals it's supposed to. And so a lot of everyone is lobbying on this, like as they should be. I don't think we are as a profession, but there's a lot of lobbying happening because we want to see, as they talk about physician pay reform and primary care reform and macro reform, we want to have a voice as we hope they shift the incentives more heavily to taking risk. And as that happens, and as we watching around us, I mean, if you look, it's out there, it's clear, payers don't want to pay on fee for service anymore. and therapists are entirely devoted to fee for service and I don't believe really understand what they're missing and what's going to get so far ahead of them that they can't catch up if they're not aware. My biggest struggle, to be honest, is I can't get a lot of interest. I hope platforms like this, I'll help find in, other interested therapists that say, ooh, I get it. I see the opportunity here. So let me stop there and see if where you want me to go with that.
Well, this is really good. And again, I think I said to you in the pre-show, I don't have exactly the same experience with you as you, but I hear and see a lot of the same parallels coming from the tech world that I came in. And so listening to you talk about that, I think I would agree. Like, people just don't realize. Like, I think it's become fashionable to, paint the boogeyman as some, air quotes, stupid politician or some out of touch legislator. It's so fashionable to talk about that now. When actually, what we should be doing is trying to figure out, what does it take to, either get to that table and be part of that conversation, or to, what do we need to maybe provide to help somebody that's representing us get to that table, And so
Mm-hmm.
I don't know how to articulate this question, but let's just say, let's kind of take that thread that you just kind of mentioned and pull on it. You said, I hope that through this sort of stuff that you'll be able to find like-minded practice owners or people in the profession. If I hand you the proverbial magic wand, what does that actually look like? Is it the data that you would need, like maybe their aggregate data? Is it having, practice owners join you at meetings in DC? What does that look like if you had the magic wand?
I guess to start is more really interest in an awareness of what the opportunities are that are out there right now, and being there being a willingness to move on those opportunities. However, if we back up further, what I see as our number one opportunity is not, it is policy focused, but it's a little, it's in addition to that. And I kind of talked about this a bit with Thomas too. It, Primary care, right? So we talk primary care. We see a lot of really smart folks, PTs, especially on LinkedIn and other platforms, talking about primary care PT. And it directionally, totally get it. We should be doing much more primary care. We're getting ahead of ourselves a little. And what I mean by that is, primary care is not what we think it is, not what therapists want it to be or think it is. Primary care is a multidisciplinary, team-based approach to whole person longitudinal care. And PTs can't do that alone. We
Right.
can say we can. We are not licensed to manage patients in primary care alone. And honestly, primary care providers, the typical PCPs, APPs, they don't have the skill set 99% of the time to manage what PTs can manage. They are licensed to, though. They have a license that covers pretty much doing everything we do, right? And so, as crazy as it is, it's the truth. So we need to work alongside, if we want to actually meet what are our goals as a profession, right? We want to meet the needs of society. That's right. Our society needs us to address physical movement and musculoskeletal neurological issues early on in collaboration with the primary care team. Before we go off and are completely independent in primary care, we need to be part of the primary care structure whose payment is completely changing. If
Yeah.
we're moving to prospective, rate book based, capitated payments in primary care, we see it on the Hill. So Senate Finance has bills, CMS is, if we look at the physician fee schedule proposal this year, continuing to heavily go down that route. We're talking about a whole different payment structure that we're going to be locked out of. And unless we decide as a profession, like, we are going to identify practices moving into advanced primary care and become a part of that team. Because right now, besides the fact that we're going to lose out on that opportunity, the Hill does not see PTs and OTs and STs, but they don't. And I'm going to speak because I'm a PT, as a PT specifically. The Hill doesn't see PTs as part of primary care, and
Yeah.
that awareness should, I believe, as a profession, should be our number one priority. We are part of the primary care provider system, and we are absolutely not recognized as that. We are not even practitioners. The list of practitioners is everyone but us. It's dietitians, mental health professionals, APPs, and it's not, we're suppliers. That to me is the number one glaring problem we have as a profession. And we have to fix it first, or our voice will not be amplified. We can complain about the conversion factor all we want. That's peanuts compared to the opportunity in front of us, and what barrier there is to getting there is really, we're really talking about a policy change that has to happen.
I feel like we're going to get along really well. Okay, so here's a crazy idea, and you can tell us to bleep this out later on. But let me just throw this crazy idea out there, and you can tell me this is the dumbest thing you've ever heard, or maybe we'll just kind of kick it around. So, like I said, I never came from this. I never came from policy. I didn't know anything. In fact, I grew up in a small town. I still live like 45 minutes west of DC in Virginia. And I say I live in DC because nobody seems to know where Virginia is. but, when I was investing in I started a venture capital firm, and the long and short of it is that, I was investing in hundreds of new startups every year and that sort of thing. And here's the point. I didn't know anything about policy. But as I was starting to think about like how to do it, this is why I asked you that proverbial, if you had the magic wand, you answered it. You have a lot more experience than me. Going back like 15 years, I was sitting there and I'm thinking like, I don't know the first thing about lobbying. I don't know the first thing about policy, but I know that when I put two really interesting people in a room together, that maybe they'll connect with their story, and that becomes the beginning of longer conversations that eventually affect policy. There's probably a cheaper way to do this, but that's what I did. So we started this thing called Geeks on a Plane. Like literally, if you go to geeksonaplane.com, I was traveling a lot anyway. So we would say, okay, we're going to DC, we're going to Cairo, we're going to all these different capitals around the world. And we would encourage, 10 to 20 interesting entrepreneurs that, anything from like early stage to like some people that were representatives of companies as large as yours. And we would just say like, look, this is not a fundraising trip. This is here's how we've programmed it. And we'd have sit downs with maybe somebody in their, elected office, and I'm just using broad terminology here. But the point is, as you're talking about this, the idea that immediately comes back to my mind is that it's like PTs on a plane, and we're just shipping 10, 20, 30, practice owners, everything from like, somebody that sees 50 visits a week to somebody that's got 30 locations in Arkansas. And we're just putting them at these lunch tables, and who knows where it goes. Maybe, worst case, everybody has a good time. But best case, maybe it helps begin this conversation. Because I also think there's a lot of cynicism. I think a lot of practice owners, and I'll say this assertively, and you can shoot me down. I think a lot of practice owners, regardless of whether they're successful or not, they think that that there's no direct correlation. They think it's like a one-way street. What happens on the Hill affects me, but I have no influence on that. And I think when you start to have these conversations, maybe one thing that happens is like the legislators or the policymakers start understanding the real stories behind this. But I think the other side of it is maybe practice owners will start to understand that they do actually have an influence here, that it's not just as simple as paying your fee to the 4-letter group we all know and hoping they advocate on your behalf, but that you actually have to do something. Yeah. What is that? Okay, so I'm trying not to name names here so we don't get in trouble here, but there's certainly a lot of consultants in this industry that say, "Hey, pay my $300 a year subscription fee or $800 a year subscription fee, and I'll tell you in my weekly newsletter what policy changes might be coming down the pipe or whatever." Okay, fine, but what do you think practice owners or clinic owners should be reading or consuming, or like how should they stay up to date? Because you're clearly plugged in. Your role and your interests already, like you're so far ahead of everybody that you make this look easy. You're like, man, this is how we got to do it. But what would you say to that practice owner that's in Florida with 8 locations and doing really well, but is ready to jump past those consultants and those those trade organizations and say, well, Dana, where should I go? What should I read? How do I get to the table? What does that look like?
Well, I'm going to answer it maybe a little interestingly differently than I think.
I love it.
Okay.
This is good.
I think that therapists should think of themselves as think of what they would be doing if they were a physician. And physicians don't just have the AMA and all of their specialty societies. They have all of all of the coalitions of healthcare. And I deal with, in my primary job, I deal with many of them. They're all physician related. There's the occasional someone else, not a single PT that I've ever met in policy except me. But I'm not there because of PT. I'm representing medical, right? I'm representing the medical community and the health policy community. So, physicians have all of these organizations around healthcare delivery are all advocating on their behalf. And then the value-based care organizations they're thinking of this from the perspective of the physician, sometimes the health system too. If we don't start seeing ourselves as one of those at the table, a doctorally trained clinician, the ability to impact care and spend longitudinally across the continuum, especially when it comes to the complexity of Medicare beneficiaries and where so much of the government spend is,
Yeah.
then all the rest of it, the little hints and tricks and tips it's not helpful, right? If we don't have the basis of what is the healthcare community saying, where is this going? Why is it going there? What's the time frame? And what does that mean for us? Because if you're not taking into account what policymakers and what those who are trying to influence policy are thinking and driving, and how they're driving it and how they're going to be successful, then we're just sitting on the fringe, right? Anything that we're doing is completely reactionary. Yes, there's lots of reaction, but maybe to demystify kind of what is, and I'm not a lobbyist, I am a policy analyst, and I work as my primary job on a government affairs team with lots of different types of professionals, but mostly policy analysts, communications people, and lobbyists. And my job is not to lobby, but I do support our lobbyists.
Yeah.
And it's not magic, right? What we're doing is there's really a need for staff that work with Congress to understand the issues and why they should devote their resources and their members' interests. We meet with staff regularly, right? Why their members should care about what it is that we think should be a priority. So when it comes to therapy, if we decide as an organization, if you have, okay, let me back up. If you have an organization like a national PT chain, right, or a national inpatient rehab chain, all of those groups should be working together and independently with their own government affairs teams to work with congressional leaders in the committees of jurisdiction that care about these things and make the case that we will help their district, will help solve problems the committee's trying to solve at a larger scale, will help fix the physician pay issue and how to reduce spend overall. All of these things this profession can do, they don't know it. So It's not magic. It's that if we don't communicate as a profession the message, the truth about what this profession can do, policymakers will not know it because they cannot possibly keep track of everything going on, and nothing is going to change, right? And the greatest example, Paul, Tom, is what mental health professionals have done. Over the past 7, 8 years, they have been diligently working on elevating their profession. What has happened, right? They're seen as part of the primary care team. They are part of advanced primary care practices almost universally. For practices at full risk, it's pretty much standard now. They're adding and elevating codes to allow behavioral health providers to do a tremendous amount more than they ever did. And now, as of this year, they're proposing to give them codes just to coordinate care, paying them to have connections directly to other care providers.
Right.
This is huge. They are seen at a different level than they were a number of years ago. That's not out of luck. It's because they decided as a profession, as their organization, as the groups that support them, they were going to work directly with the medical community. They were going to work directly with the Hill and with CMS. Regulators are incredibly critical here, and get the profession seen in a different way to solve problems. If we don't have the profession viewed as solving the problems that policymakers care about, not the ones we think they should care about, what do they care about? And we can connect our solutions to things they care about and show them how it'll be a solution for their committee, for their own members' jurisdiction. You can make change this way. You
Right.
absolutely can.
Yeah.
And,
Yeah.
it's kind of like my call to action is therapists, like, now's the time. So I would love, for me, what I'm trying to do in my little newsletter, where I'm trying to start, is just to get healthcare professionals to read and react to, wow, like, this is something I should pay attention to. This is something I should care about, and then start to dive. None of what I've learned, what I've learned, how I'm working on a day to day basis is because of some, like, incredible course. I completely learned it on my own, do my own research, my own diligence, and anybody can do that, right? Whether or not you want to stay in a clinic full time, whether or not you want to change the direction of your career, whether or not you want to move into something else, when you know policy and you understand how policymakers, regulators work, you can do pretty much anything in healthcare, right?
Right. Yeah. Well,
So
I think that's, and I say this maybe for any listener that's already like, I think there's probably going to be a couple listeners that are just sort of rolling their eyes. They're still not convinced that, this is even worthwhile. Right. And I think my own sort of experience with this is that I think before I ever tripped and stumbled my way into tech policy, um, I guess I had this impression that everything was black and white, that policy is black and white. And then if a legislator or, at any level made a bad decision that I didn't like, then they were the problem. And what I learned along the way, I think, at least in my own experience, and I think you would agree with me on this, is that these are actually reasonable people. In fact,
totally,
and
totally.
I lived in downtown DC before my wife and I were married, and I just remember there was an etiquette in downtown DC. You would see these politicians sitting at the same Trader Joe's picking oranges, putting them aside, like that one's not good, that one's not good. And you're like, huh, that person on TV somebody said he was an asshole on TV. And you're like, well, but he's kind of normal. And you realize really quickly that these are normal people. But I guess where I'm going with this is that my experience was that once 99% of the work, I think, is in establishing the relationship. I think even though we've talked about getting to the proverbial table, there's really not a table. Most policy decisions are made in the hallways of something. They're made on text chains. They're made in the lunch conversation somewhere. And when you start to think about it that way, the time commitment, at least for us on the tech side of things, was like, I think our biggest challenge with getting a lot of these entrepreneurs to take 2 or 3 days out of their time to come visit, DC with us, with these geeks on a plane, was convincing them that it was not 3 days a quarter or 3 days a month. It was really
Hmm.
just, hey, let's just go one time and let's have you tell your story. Worst case scenario, you meet some new people, you get some nice lunches or whatever. But best case scenario, you're trading phone numbers, and some staffer for some elected official somewhere is going to text you one day and say, hey, I have a question about X. Do you have any data to support it or refute that? And that's what it actually looks like. I mean, I love that you said you're not a lobbyist. I think most people are not lobbyists. We're just normal
No, and
people.
lobbying
And
is not some magic thing, right? It's
right. That's,
communicating, it's developing relationships.
yeah.
I, I haven't met a single person in my time. And again, it's not what I do day to day. I support, but I've pretty much everyone's reasonable, right? You're just trying to solve problems. And it's kind of in a way like business development, if you want to say, like, you're just trying to reach someone and groups on a level that is meaningful, and it takes time. And it's like, it really truly, it's not magic. It is skill. You develop the skill, but
This is totally off topic. You can veto this. I am curious, like if we went back in time 10 years or something like that, pick an arbitrary time. If I was talking to Dana 10 years ago, did you see yourself going down this path? Like, was policy something you always thought about, or how did you, just high level, like, what was it? Was it, what is that something you always wanted to do to get here?
no, I had absolutely no idea 10 years ago this even existed as a possibility. I'll tell you just an interesting story about how, I'll try to keep it quick, but how I ended up here. I I was working in a health system, and I was lucky that who I reported to was going to be starting the ACO in northern New Jersey, and so it was one of the first ones. And I made the business case for and just presented an ROI on how I could, help to manage the spend of, transitions to care spend, post acute spend. And they accepted it, and I was able to start this team and saved a tremendous amount of money. It was right time, right place, saw the opportunity. And, luckily someone in a group saw what I saw when I
Yep.
brought it to them. I once it had, and I love that health system. I was there a very long time, but for my own professional growth, took a position at a startup and became the policy expert because during these years of working in population health in the health system, I just had to become an expert because there's no experts. It's new. And I loved it. So as I dove deeper and deeper and started reading thousands of pages of rules, then I decided to, I was helping create strategy for a startup that was focused on value-based care. I came over to the company that was purchased by the company I'm at now. I came over in client success. I really liked their message. It was kind of like just a gut decision that this opportunity came. I came in client success. And here's what happened. It is a crazy story. Years prior, I had reached out to someone on LinkedIn to ask a question about CJR, the Comprehensive Care for Joint Replacement Program, which I was having to take over. And it was kind of like a sudden thing. We didn't realize we were in the mandatory part. We were participating in the bundle, BPCIA. And anyway, long story short, I had a really intricate question and I needed an answer immediately. And I just decided, I can't find it. I'm going to reach out to this guy. He was wonderful, talked to me for like an hour. He happened to work for Signify. And when I came over to client success and Signify, he recognized me and said, "Oh, we should bring Dana into some of these conversations." They were moving more into value-based care. And I was offered a position on the policy team. That's it. That's how I got here. It's that, if you go organically with what you feel is the right thing and you listen to your gut and what means something to you. I mean, it sounds hokey, but really it's just because I trusted myself and that I knew this was going to be the future because I understood it really well. So that's how I ended up in policy.
I mean, I love it. I love that you're willing to share it too, because I think a lot of, well, I don't mean any disrespect with this, but when you hear stories like that, it sort of reinforces the fact. I think there's this narrative of, the overnight success or there's this like romantic view of like how people became so successful in their fears. But the way you talk about your story is really a series of, um, trips and stumbles and decisions and all that stuff. And it worked out. And I think that's in my other world, I think about entrepreneurship and entrepreneurial thinking. People have this vision of what they call the overnight success, when in fact it was maybe 20 years of overnight, hard work and all that. So anyway, I appreciate
But
you.
I will share one more thing about this that's related. And I think now that you said that, you'll find this fairly interesting. Many years before, what I just explained had started around 2014, right? Was where I started moving into pop health. The health system was going that direction. In 2001, so really long time ago, 2001, I was 3 years into my work, and I was getting married, and I was leaving the inpatient rehab facility to come to home care, with a little stint in outpatient also because I needed the flexibility. We wanted to have kids. Okay. My first day there was also my manager's first day. And I'm very green around the edges, but I was figuring some things out pretty quickly that bothered me. It didn't seem efficient or smart. And I said to him, "Howard, listen, I know we're just meeting, but we need to start a direct to home total joint replacement program. I just came from Kessler, right? I have these, complex trauma patients, amputees, CVAs. And then 3 days into total joint patients being there, they're running around the facility. CMS is billing $17,000 they're getting for this. They don't need to be there. They can come straight home. There's absolutely no reason why home health should be cut out of this. And because once they go to inpatient rehab, they go right to
Right.
outpatient, right? They don't need home
Right.
health. Why are we being cut out? It's complete. I don't see a reason why we can't start this. He agreed. He was also very innovative. We started one of the first programs that we know of in the country, direct to home. And so when it became popular over the next 5 or so years, the New York hospitals found out about us and were sending their Jersey patients direct to us. They didn't want them in inpatient either. And so it just was logical. Let us, we'll capture, and it was good for the business.
Yeah.
The home health isn't cut out. They're getting the HHRG. CMS benefits because they're skipping out on the 17,000. You're reducing that person's risk. They go from home health to outpatient faster. No brainer when you can figure out how anything will work for your business and is best. And it's going to eventually be the norm. Figure it out sooner and get ahead of it. And that's kind of how I've tried to drive my career. I know what's going to come because it's the only thing that makes sense. So where do I have to position myself now and just trust that it'll work itself out over time?
It's interesting, like listening to you talk about things, because you sort of, and again, I apologize. I know we don't know each other that well, but I mean this with a lot of respect. It's so fascinating listening to you connect all these seemingly disparate ideas together, but really the common thread here is missed opportunities. You're elaborating, or you're articulating various missed opportunities. Um, you know, Let me throw a random idea, a random thought that I had from the tech world out, and let's just see if this kind of resonates with you or if it kicks off a thought for you. Um, One of the biggest challenges for early stage technology startups in the last 20 years has been office space. Now, obviously, post COVID, everything's remote. Okay, no big deal. But people forget that there was a time before that, and there were offices and stuff like that. And one of the biggest challenges for a lot of entrepreneurs was, where do we actually office? And co-working spaces started to
Mhm.
bloom and stuff like that. And one of the things we would find at the most local levels of government, at economic development levels, is that economic developers genuinely want to see more economic development in their community. They want to see more dollars, more taxable revenue, da da da. And it was like our startups. And so we've got, for full disclosure, a little over 3,000 companies we've invested in. Our companies were struggling trying to find places to office. We had economic developers coming to us and saying, we want more startups in our area. And we'd say, well, we have those. Oh, you're from Nebraska? Here's all of our companies in Nebraska. Here's where I'm going with this. And let's see if it sparks an idea for you. I finally had to do we did a biannual. So every 6 months, we would get all of our portfolio companies to join us back in
Mhm.
Silicon Valley to
Mhm.
talk. And I remember distinctly at one point saying to everybody, I was like, hey, raise your hand if you're one of our US companies. And they would raise their hand. And I'd say, okay, next time an economic developer asks you what your head count is, because that's the only way they know how to measure any sort of footprint of economic activity. You are going to avoid that question and simply answer with what your revenue is. Now, I'm exaggerating a little bit, but what I was trying to convince everybody of was that these economic developers did want to help. And they actually were willing to give subsidies to a lot of these startups to office and domicile in those geographies. The problem it was like somebody speaking English and somebody speaking Mandarin. They both want
Mhm.
the best for each other. Neither understands the other side. So
Mm.
an economic developer would see a startup with 8 employees and say, I'd rather spend all my money and budget on getting that factory of paper plates over here because I'll get 500 jobs. And we'd say, like, look, that's 8 people. Yeah, I get that, but they're doing like 4 million a year in revenue. And so anyway, that ended up kind of beginning, in hindsight, became one of the earliest, when I think about my stumbling into policies, one of the earliest sort of wins we had, where we were like, oh, they all want the same thing. They're just talking different. So now let's tie this back to maybe missed opportunities. That's been a common thread of a lot of things you're talking about. Um, so let me just kind of prompt it and be quiet here. So in the context of missed opportunities for PTs, how else can they be shown their value to policymakers? Is it talking about the types of problems they're seeing in a certain jurisdiction, or medical issues they're seeing? Like, what does that look like in terms of missed opportunities?
Yeah, that's a really good question. And when I try to touch on it, I really love you calling it a missed opportunity. Uh, I think the therapy community has not done a great job quantifying how we prevent spend. And it's always hard, right? That is a hard thing to show. It's a hard thing to prove. But if we can make the case that collecting and reporting on that data is part of the story, everyone wants data, right? It's part of the story, will help make the case for why we should be an integral part of what is being developed next. I'm going to kind of transition that into the new team model. The transforming episode accountability model. Okay, and it's part of a 3,000 page rule for the IPPS. But when you start to go through it, CMS is actually categorizing outpatient therapy as one between outpatient therapy and outpatient physician practices as the types of practices that can directly contract with the hospital to be their, essentially be preferred providers. It's more complicated than that. But if if the therapy community doesn't hop on this opportunity quickly, right? These hospitals
Hmm.
are mandated to participate. It's not like it's an option. The voluntary, you first have to convince an organization to do it, and then you have to convince them to work with you and that you're going to help reduce the spend so that they get shared savings in the value-based space. To me, what's going to be the next missed opportunities if we as as a profession can't show how we are a solution in the value-based, an untapped solution in the value-based care market. And when it comes to something like 30-day acute episodes of care mandated by CBSA, and we are called out as a profession that you may get into contracts with the hospital. If I were a therapy organization, right? Again, I do nothing with this with related to therapy in my day job. But if I was a therapy organization, I would be on that list, looking at every hospital in every CBSA, making my value, getting my value proposition together and offering to help support them in any way possible. Help you
Yeah.
with deciding on discharge planning, help you create a hospital mobility program so that people don't
Yeah.
get deteriorated and go to inpatient sites of care, help them immediate access to therapists at their home the day they're discharged. How am I going to be that solution? And then you start to tell the story over the course of that model of the role therapists are playing in the success of hospitals meeting their new requirement. And it's not like it's a little penalty. We are talking about a 10%, I think it goes up to actually 20% up and downside penalty for your typical, your safety nets CMS would took. Again, you want to, like, great example of how you can absolutely influence what policymakers do as long as you're making the case that they see the benefit for them. So in this team model, it's the transforming episode accountability model, 30-day surgical episodes starting at the hospital. It's going to begin January 1, 2026. In these episodes, there will be a target price depending on what the surgery is. They do plan to expand this into more than just these 5 sets of episodes, 30 days, and then there's a target price. And if that spend between the anchor and the 30 days after is higher than the target price, the hospital is paying CMS. That is a scary place for a hospital to be mandated to participate, right? And so, what are the levers? They're all levers for success that therapists can control. Hospital mobility, there's been no incentive for hospitals unless they just decide it's in our mission. But hospital mobility, there's been no incentive. It's a cost center, right?
Yeah.
But
Yeah.
mobility teams, excellent discharge planning, understanding home settings, training caregivers, getting patients home, avoiding home health when it's not necessary. A lot of the patients will need it, but some don't. Guess what? Another opportunity for therapists. So to me, I say we've missed a lot of opportunities. We have, but this one is a big call out, right? This is the opportunity to show our value. And then, of course, the dementia models and other. It's probably too much for this conversation, but the dementia care model has a lot of opportunity for therapists to show their value to both the overlapping patients in the ACO and to the guide model participants and their partners.
I know I want to be respectful of your time here. So, what would you say to, so let's just say, somebody, a practice owner, clinic owner is sitting in Michigan right now listening to this and they're thinking like, okay, all right, Dana, I'm on board. Yes. Yeah, let's go. Uh, I would think the right answer in terms of the next step is no, don't book a trip to DC. That doesn't make sense. But what is starting? So if somebody's listening to this and they're like, yes, I want to be part of this. I want to, trip and stumble my way into policy as well. I know this is a generally broad question, but just where would you advise that person start? Does it start at reaching out to the local hospital system? Their local congressperson? What does it look like as a first
Yeah,
step?
no, that's the perfect way to direct how a response is probably going to be valuable. Well, first of all, I'll go back to a question you asked before because it's related here. Where would you start if you want to, become more educated on this? Certainly follow my newsletter. I try to touch on these things as where I have, I would follow Accountable for Health is a fantastic organization. It's pretty new, but they're very focused on value-based care, advocacy, and policy. The National Association of ACOs, the big trade association for accountable care. I will tell you, if there's maybe one PT organization at one of those, that's it. So this is, NACOS is thousands of organizations accountable for health is smaller, but participate at least to the degree to start with of signing up for their newsletters and reading their websites, right? Uh, the Healthcare Transformation Task Force is another great organization that publishes all kinds of amazing free content. America's Physician Groups, again, these are physician groups, but if you don't know what's happening in the physician space and you're not putting yourselves at that same playing field as where the rest of the medical community is, you won't know what you need to know to be successful in this. And then really, there's no shortcut to going into the final rule and reading through 400 or 500 pages to understand what it is they're proposing, right? So the model is complicated, but not too complicated for anybody to not understand. You can, right? I mean, and once you understand how it's structured, then as if you're talking about, the team model, for example, once you know how it's structured and you see the risks and the opportunities for the hospital, you can develop a business plan and a proposal to bring to your local hospitals to support them in the program and get in first, because it is going to be a matter of, they're not going to partner with more than, a few therapy clinics. They're going to want to find ones they trust, that are giving them the right feedback, that they have the data to support why they're going to be great partners. And then they're going to try to drive patients to those partners as best they can. When you put someone in downside risk, things change, right?
Yeah.
So follow some of those organizations, and then follow, PTs should be on the AMA's website. They should be getting their newsletter. Orthopedic Society, don't shy away from what the physician community is doing, because that's the same table we have to be at. You can't do it unless you know what they're talking about. So I would say those are great places to start. At least subscribe to those newsletters. And if I was a national chain, I'm speaking to all national chains listening, or large groups. Join Accountable for Health, NACOS. Get into these organizations and be a part. They bring CMS in. They keep you up to date on a lot that is hard to do otherwise. Even just reading their website, you're going to learn a lot.
Yeah. I love this. It's so practical too.
Yeah.
I think I'll probably, at least on my end, probably end my little ramble by just kind of telling I suppose, like maybe a bad joke. And that is that, clinic owners, it's been sort of I've only been in this industry for maybe 2 years now, and our business has been around for like 12 or 14 years now. But the point is, though, is that I find that the clinic owners are so fascinating, because like in one breath, if I say to them, hey, I'm training for this marathon and I hurt my knee. What should I be doing? And they would say, Paul, there's no quick fix. Here's what you need to do. And, to not only heal, but prevent the injury. Like, they start from the position of there is no quick fix.
Yeah.
But then you introduce the idea of policy, and they're like, well, they just need to do something. That's the irony of the whole thing, is that,
that's the wrong
really,
attitude. They don't need to do anything. They don't need to do anything. They are our customer. CMS policymakers, we need them, right? We need them, and we don't need them to just do what we want them to do because we think they should. It doesn't work that way. And honestly, I'm so glad you brought that up, because that's, to me, one of the biggest barriers we have in this profession is like a stomping our feet. It should be this way. Why don't they see? Because they don't owe us anything, right? Their job is to serve their communities and to serve the public. And if you don't reach out directly and work with them, you're not going to get what you want, no matter how many times you say it should be this way, it shouldn't be this way. It doesn't work that way. And it is completely possible. This is my call to action for the profession as a whole. Think about where you want to be. Where would you want to be if you could have it exactly as you think it should be? What should the opportunity look like? What table should we be sitting at? Imagine that and think about that as 5 to 7 years in the future. And we need to start mapping out a plan to get there. What has to change? Who do we have to work with to change it? what's going to be the first, second, third step, and start broad. The first step is educating ourselves, understanding
Yep.
how it works, and develop a strategic plan over. I mean, when you look at the shadow organization groups of organizations, the mental health community, it took them about 7 years to get what they got, but they have done a lot of that headwind work for us. And if we can hop on the really hop on this bandwagon, all center around a couple of like key strategic goals that'll set the profession up in the future, then you can hop on the opportunities as they come around. My second call to action, and I've said this on a lot of podcasts, is go PTs, please, some of you join primary care practices. We need both. Okay, primary care and specialty care, we sit in both worlds. We have to show our value to primary care. Primary care has the incentive. They're the ones taking full risk, right? If they're going into a full capitated environment, risk-based contracts, the primary care providers taking risk, they're incentivized to reduce unnecessary specialist spend. That means specialty doctor spend.
Right.
If we can catch musculoskeletal issues early as part of a team, and we avoid MRIs, unnecessary medications, unnecessary surgeries, duplicative tests, that's where a lot of the opportunity comes in as we look at like, how to manage total cost of care, right? Yes, you're doing a lot of hospital prevention, but that component, and I will tell you, and as someone, as we talk about like, where are we going? What's important now? The last 3 to 4 years have been focused on primary care. The community, both the Hill and the accountable care community, are now thinking a lot about specialty care. And how do we get control of a longitudinal specialty care spend where most of the spend is, as primary care keeps working to advance what primary care can do as a team, and we should be in that space. But how can we be a part of the solutions that we're creating for at least a couple of the specialty areas to get specialty care spend under control? There's going
Yep.
to be more models introduced in the next couple of years, and those models are very likely, I mean, I'm not repeating anything that CMS hasn't said directly, they're going to include specialty care, and they're going to be making plans that will influence our profession too. And you want to see at that table. We are primary care, we are specialty care. What we shouldn't be focused on, at least not solely, is independent therapy, like primary care PT specialties. Not that it doesn't have a place. The problem is the foundational work of strengthening our role in the healthcare delivery system is not anywhere near done. And so
Yeah.
those primary care teams, they're not going to be able to manage more than, some of the simple things. They're going to be, but we're going to need to be able to refer to specialty care therapists on the outside to really great primary care PT practices. It's not that we don't need them, but we have to start a presence that we can speak about as part of advanced primary care teams.
Yeah.
That
It's sort
has
of like
to
inside
happen.
out. Yeah.
That's
It's like
it.
inside out. Yeah. Yeah.
That's
Yeah.
it.
I love it.
Thanks for listening to another episode of Strata Stories. Strata PT is a single EMR platform and revenue cycle management service for physical, occupational, and speech therapy practices that helps you achieve a 99.99% reimbursement rate. If you'd like to learn more about Strata PT and see how our EMR and RCM works, head over to stratapt.com to book a demo.